Hi, Mr. Smith. My name's Rachel, one of the vet nurses. How are you today?
Alright, a little bit overloaded by everything the vet said. I didn't really take in much. He also mentioned something about getting some special food for the cat.
That's okay. That's why I'm here to help explain things a little bit better. So, as you know, Stitch was hospitalised and treated with us the past couple of days for a condition called feline lower urinary tract disease. So this disease affects the bladder and the urethra, and unfortunately it's a life-threatening, can be a lifelong condition.
What are the signs of the condition? I only brought him in because I thought he was constipated.
So that is one of the signs, as well as frequently going to the kitty litter, producing no urine or very small amounts of urine, or any urine with blood in it, crying out or yowling when he tries to go to the toilet, any inappetence, so not eating, any vomiting are also signs as well. Excessive licking of his genitals is another indication as he's trying to relieve himself.
Yeah, right. And what are the causes of the disease?
So the three main causes are your bladder stones, crystals, your urethral plugs, as well as bladder infections. So the stones generally start off as a bladder infection and can then transform into bladder stones, so they go hand in hand with each other. There are other causes, but they're not as common, so like urethral abnormalities and tumours in the bladder as well.
Right, well, how do I stop him from getting it again?
So there's a great diet that we stock here in the clinic called Hills Feline, CD low stress, so urinary care. So this food actually helps to prevent the formation of these stones in the future. What kind of food does Stitch like to eat, and does he prefer to eat wet or dry?
He's pretty fussy. He does love chicken, and I generally just feed him wet food.
Okay, great. So we can start him on these yummy chicken and gravy pouches. So yeah, we can get him onto those soon.
Alright, so what's so good about this food over like fancy fish?
So the great thing about this food, it's got low levels of phosphorus, magnesium and calcium with added levels of potassium citrate, vitamin B6 to help prevent the crystal formation. So this diet increases the urine's pH to make it more acidic to help prevent the formation of any bladder stones or crystals in the future. So which in combination, it's got reduced amount of minerals to also help stop the formation as well. So the added antioxidants help control the oxidation and promote a strong, healthy immune system. And the stress side of things in this food, so that it's got an added milk protein which helps to relieve anxiety.
Now, I don't really want to have to bring him in to go through surgery again, so when and how much should I be giving him a day? I do work from home.
That's okay. So I've worked out a resting energy requirement here for Stitch. So he is a little bit overweight, so we would like to be keeping his food as minimal but still meeting his requirements as possible. So I want to be feeding him 220 kilocalories a day. So that'll be his daily energy requirement. Now there's 71 kilocalories in these pouches, so looking at just over 3.1 pouches per day, or 264 grams per day. So how often did you say you feed him?
I generally just feed him in the mornings and at night, so twice.
That's okay. So just go 3.1. So it'll be just over 1.6 pouches per day, or 182, just over 182 grams per feed. Sorry.
Alright, cool. I'll get some.
Okay, great. So with this new food, just need to keep in mind that we want to transition over to it gradually. So if we can do it over, say, the course of 14 days, so start off a very small amount. By the 7 days, try and be at 50%, and then 75%, and then 100% at the 14-day mark. Now, if you have any problems with Stitch, obviously bring him back straight to us. We want to make sure that he's toileting, so he's urinating okay by himself. And we would like to see you back in 3 months if we don't see you before then. So we want to recheck that urine, make sure so there's no bacteria, as well as no stones still hanging around as well. So yeah, that way we can just check, make sure we're staying on top of things.
Cool. Thank you very much, Rachel.
Thank you.